we know that there are a couple of companies out there that are making different topical toxins, and I can count 3. Not all of them have been discussed, but I can count 3 who are working on them. So the most discussed company is Revance or Revance, and they are talking about RT001. They're working hard on getting this together for lateral canthal lines. We know that this molecule is essentially a toxin that is non-covalently bound to carrier proteins, and that's how it gets through the skin. And the question really has been, I guess for us, is it going to be effective? Is it going to provide us long-lasting results? And more than that, can we get it through the FDA? That's sort of where we are.
I hope that they can, and it sounds like it will be effective from the data that I've seen. However, it's a matter of just having a reliable product. I think they had a little bit of a glitch in the processing that they're over now, and so they're moving forward again. I think the other problem is that the way that it's set up now, the patient has to sit in the office for 30 minutes after you apply it before you remove it, and that's going to create a little bit of a space issue for many of us who are space challenged in our offices, and also patients' patience when they have treatments that they can have in a minute and leave the office. So I think it's exciting to have new options available. I am excited about Revance and even the potential for it being an option of having it as an injectable and a topical. So yeah. I think expanding the market, expanding our ideas and understanding is always going to be good. I, again, don't think that anything will be a threat to the neuromodulators that we have available as injectables. And competition is good as well, because every molecule, being a biologic, does have its own kind of flavor, personality, or trait that's subtly different than the last one. And we will go to ones that we like better for certain areas. We may mix them. We may start doing it as a form of meso and mixing it with our fillers in different parts of the face to notice skin tightening, pore reduction, even pore size reduction, which we really can't do with what we have now. So I think it's only going to expand the opportunities, and we take it beyond the face for hyperhidrosis. Maybe there's an opportunity there without needles to have a dramatic improvement, and even just for beyond the underarms, the hands and the feet, which are horribly painful to inject. So I think that the opportunities are really great, and I'm excited to have new products available.
I think that's all true, and I think that what you said about what I call cross-training, where you're mixing technologies together. I think that is really, really interesting and really important, because we're artists in a way, and we have a palette, we've got a toolkit that we want to use, and whether we're plastic surgeons or whether we're dermatologists, this provides us with more to use. So it's all good.
Yeah, I like to think of it as blending, that we're blending all our different tools in ways that will optimize both the outcome and the longevity, but also keep it real, because I think one of the problems is that we get good at doing what we do, and so people tend to go out, they learn how to do things one way, and some people, unfortunately, are still stuck in the old days of just filling the nasolabial folds from the days of Zyderm and Zyplast, when we were lines and wrinkles chasers. So now it's really way beyond that. We're not chasing lines and wrinkles, and we're not looking at just one part of the face. We're expanding, looking at the temples, the position of the brows, the shape of the nose, the jawline angle, how the face recedes, and how you have structural changes at every level as we age, and working to rebalance that, but not to change someone looking uniquely like themselves. And I think that's going to be our great challenge, but to have all these tools available is going to be so helpful.
I agree. Thanks very much, Doris. And thank you for watching this episode of Modern Aesthetics Journal Club.